Hello freedom lovers, this is Professor Terry Lovell speaking to you for the Patriot Network, and we're here today to talk about healthcare. And I'm going to make a couple of comments today about civility in discussion, and I'm going to make a plea for civility at the end of this video, but I wanted to mention to you that any time that you discuss anything in the United States today, the attack from the left end of the spectrum always goes like this. A, you're not qualified. B, if you are qualified, you're outside the mainstream of thought. C, if you're in the mainstream of thought and you are qualified, then you're a paid lackey of the corporate interests and you're trying to resist the natural progressive change that America should go through. Well, it just so happens that that's not really true. That's a particular paradigmatic way of dismissing people, but it's possible to be a person of good conscience who just objects on the basis of the facts. So when you write in to leave your comments, please leave comments that are based in the facts and have to do with the factual content of the argument. It doesn't advance either side's cause to write in and say derogatory things about either myself or my technical guru or anyone else. It behooves us to have a discussion, an intellectual discussion that's based in the facts that allows us to manage policy by fact. And I want to go to a factual representation today taken from the Wall Street Journal, Wednesday, November 18th, and it is an editorial written by Dr. Jeffrey S. Flier, who is the Dean of the Medical School at Harvard University. Now, before the attack starts, if you're a medical doctor to begin with, you're qualified to talk about the medical bill that passed the House and went to the Senate. If you are a medical educator, you're even more qualified to talk about the impact of this bill on doctors and prospective doctors, future doctors. And finally, if you're the Dean of the Harvard Medical School, for the sake of argument, let's just say that it's one of the most prestigious, instead of saying it's the most prestigious because somebody might have an argument with that, it's clearly one of the oldest and most prestigious medical schools in the United States. And the Dean of the medical school at Harvard probably has a little bit more knowledge about medical care in America than the average person on the street. Like they used to say in the commercial, I'm not a medical doctor and I don't play one on TV. But Dean of the Harvard Medical School, Dr. Jeffrey S. Flier, is a doctor. He is the Dean of the Harvard Medical School. So let's listen to his editorial. And my goal for today is to cover this entire editorial. And I'm going to read to you directly from the editorial. And there's a couple of places that I want to add emphasis from my training in business and economics about the forecasts for the cost of the bill. So here we go. And by the way, underneath the YouTube video box today is the website for the Wall Street Journal editorial page where this editorial appears. And if you'd like to read Dr. Flier's editorial, it's there for you, okay? So, this starts out, and again, Wall Street Journal, November 18th, 2009, Jeffrey S. Flier, Dean, Harvard Medical School. As the Dean of the Harvard Medical School, I am frequently asked to comment on the health reform debate. I give it a failing grade. Instead of forthrightly dealing with the fundamental problems, discussion is dominated by rival factions struggling to enact or defeat President Obama's agenda. The rhetoric on both sides is exaggerated and often deceptive. Those of us for whom the central issue is health, not politics, have been left in the lurch. And as controversy heads toward a conclusion in Washington, it appears that the people who favor the legislation are engaged in collective denial. Our healthcare system suffers from problems of cost, access, quality, and needs for major reform. Tax policy drives employment-based insurance. This begets overinsurance and drives costs upward while creating inequities for the unemployed and the self-employed. A regulatory morass limits innovation, and deep flaws in Medicare and Medicaid drive spending without optimizing care. Speeches and new reports can lead you to believe that proposed congressional legislation would tackle the problems of cost, access, and quality. But that's not true. Now, I want to stop right there for a second. The Dean of the Harvard Medical School is telling you that what is being said by the proponents of the current healthcare reform bill, that it will tackle the problem of cost, access, and quality. He is telling you that from his position as a medical doctor and the dean of one of the premier medical programs in America, that these talking points that are put forward by the people on the left in the United States House and Senate who say we're going to lower cost, we're going to increase access and increase quality, he's saying that's not true, that it's impossible given the current situation to do that with the current bill. Now, for anyone who's on the fence about whether or not it's a good idea to pass this bill, I think that you have an obligation to the factual truth to listen to the dean of the medical school at Harvard University when he says, you know, what he's actually saying here is this bill won't tackle the problem of cost, it won't tackle the problem of access, and it won't increase quality. So when you look at that and look at a statement this harsh, deans are notorious for saying things in dean speak where nobody knows what they're saying. For him to say, but that's not true, is a very powerful repudiation of this bill. The various bills do deal with access by expanding Medicaid and mandating subsidized insurance at a substantial cost, and thus addresses an important social goal. However, there are no provisions to substantively control the growth of costs or raise the quality of care. So the overall effort will fail to qualify as reform. Now, again, I want to emphasize this last sentence. The overall effort will fail to qualify as reform. In other words, we're going to spend $1 trillion+ and not get what we've been told we'll get. And just real quickly to do a little history with you, when Hubert Humphrey, who was a fierce advocate for Medicare, when he stood on the floor of the Senate, he said, if the cost of Medicare ever goes over $10 billion, I'll come back here and eat this bill. Well, Medicare is now $430 billion. Identifiable fraud is in the range of $60 to $120 billion, and it just depends on who you ask on what the identifiable fraud is. So just the fraud is somewhere between 6 and 12 times as much as the whole bill was supposed to cost. So this $1 trillion bill, if it performs true to Medicare, you're looking at somewhere between $6 and $12 trillion. So I would say be afraid, be very afraid. Back to the editorial. In discussions with dozens of healthcare leaders and economists, I find near unanimity of opinion that whatever its shape, the final legislation will emerge from Congress will markedly accelerate national healthcare spending rather than restrain it. Now, the whole logic behind this bill is we've got to tackle exploding healthcare costs. The dean of the medical school at Harvard University is telling you that in his discussions with the experts in the field, both healthcare leaders and economists, that the opinion is nearly unanimous that this will not restrict healthcare spending. It won't restrain it at all. It'll lead to an acceleration in spending. Back to the editorial. Likewise, nearly all agree that the legislation would do little or nothing to improve quality or change the healthcare's dysfunctional delivery system. The system we now have promotes fragmented care and makes it more difficult than it should be to assess outcomes and patient satisfaction. The true costs of healthcare are disguised. Competition based on price and quality are almost impossible, and patients lose their ability to be the ultimate judge of value. In other words, it's not a free market. Worse, currently proposed federal legislation would undermine any potential for real innovation in insurance and the provision of care. It would do so by over-regulating the healthcare system in the service of special interests such as the insurance companies, hospitals, professional organizations, and pharmaceutical companies, rather than the patients who should be the primary concern. Now this description of what's happening on a political basis shouldn't be very surprising to anyone who's familiar with politics. The most powerful contingents are always given the most in any political decision. Politics is all about who can support you as a politician. It's not surprising that the average patient is not going to be the primary concern of this bill, even though the dean of the Harvard Medical School says the patient should be the primary concern. They will not be.